na, Gabi. Basta magbantay ka lang dyan, ha?
Wala naman pa ako. Dito.
Huwag ganyan.
Tama, ganito.
Hindi dapat ganyan.
Ganito.
I-design na.
Ganyan nga, sabi ni...
I-design na.
Ganito nga.
Hindi nila magugustuhan. Ang sakit naman ng sa bunot mo.
Ganito. Ano ba ang problema mo?
Ikaw! Ikaw ang problema ko! Tumulong kayo!
Aray. Yan, okay na to.
Kulang pa yan.
Okay na to.
Isa. Dahan-dahan.
Yan po, sa inyo po yan. Masarap po yan. Papa Jesus, mag-pray tayo. Sana po, pagbatiin niyo na po si Mama, tsaka si Papa. Para po, happy family na po kami. Tsaka para hindi po kami magkakahiwalay na magkakapatid.
Please. Thank you po. Tsaka po pala, Papa Jesus, bigyan niyo po sana kami ng baby boy. Please.
Tama, baby boy! Please!
Kasama ko sa hirap at ginawa sa mundo. Pagsubok ng tadhana, ikaw gustong kasama. Mula sa'yo ang aking saya. Sarap karamay sa mundo. Sarap karamay sa mundo. Mahal ko.
Ma, tama na yan.
Saglit lang, alam mo naman, dumi-dumi na itong bahay natin kasi kayo magkakapatid eh.
Eto, uminom ka na ng gamot mo sa diabetes.
Ano ba yan? Ay. Oh, salamat anak. Nasaan ba si CJ? Ba't di pa siya kumakain?
CJ, baba na, kakain na.
Ito, bababa na!
Oh, kanina ko pati na.
Good morning! Good morning, ate.
Oh, kain ka
Good
na.
morning.
Ay, kabango.
Bango-bango naman. Sarap naman ng ulam.
Ay, nako. Kanina ka pa tinatawag. Kanina ko pa kita pinapakain. Ang tagal mo.
Oo
Ito
nga.
na, ito na nga kakain na. Ate, ito ka na.
Ay, bakit ka pala nakapambahay ka? Wala ka pang work ngayong araw?
Hindi ako mag-work, ma. Hindi ako papasok ngayon.
Bakit naman?
May lakad kasi kami nung girlfriend ko, ma. I mean, fiancé.
Fiancé?
Ate, ma. I'm getting married!
What? Kakasal na siya?
Yes, Ate Bobby.
So he and his ex-girlfriend got back together.
Eh, sana nga, yung ex niya na lang, no? Eh, kaso hindi.
So ano naman ang reaction ni Mama?
Of course, she's not happy. Eh, kailan niya lang nakilala yun eh. Eh, tapos, ito pa. The wedding is happening in 2 weeks.
2 weeks?
Yes, ano mang opinion natin. Basta kailangan mo nang umuwi.
Okay, I'll check my schedule sa work kasi baka hindi ako makatawag sa Sabado. Busy kasi ako sa work. Pero sure akong hindi ako makakauwi, okay?
Okay, sabihan mo na lang kami.
Okay.
Napapadalas na yung pagsakit ng tagiliran ko. Hanap nga ako ng site na pwedeng gamitin para makapag-online consultation.
Oh, patient. Hello, thank you for calling Dr. Fortaleza. How can I help you?
Hello po, Doc. Magpapakonsult po sana ako.
Sure, what is it?
Lately po kasi, Doc, nakakaramdam po ako ng sintomas. Napapadalas na po ata sila, Doc.
Do you know what your symptoms are?
Sudden, sharp abdominal pain po.
Okay.
Tapos, particularly sa bandang bato po. Tapos, yung sakit pabalik-balik po. Tapos bigla na naman po sasakit. Tapos nagkakaroon din po ako ng other symptoms. Nilalagnat po ako, nasusuka. Minsan po nawawalan po ako ng appetite. Yung hindi ko po like cloudy. Tapos matigas po yung stool ko. Ano po nangyayari sa akin, Doc?
Oh, it seems like you have acute cholecystitis.
What is that, Doc?
So based on your symptoms, usually if you have acute cholecystitis, it is a sudden sharp pain in the upper right of your tummy. So usually in your abdomen, if you have like an extreme pain that spreads towards your right shoulders, usually it's affected with extremely tender pain, especially when you're breathing deeply. It can even make it worse. So unlike other types of abdominal pain, this is a little bit different because the pain is associated with acute cholecystitis. That is, it doesn't want to go away within a few hours.
Ganun po ba, Doc? Anong pwede natin gawin kaya?
Yeah, so I advise you to go to your nearest hospital. That way they could get this diagnosed and you'll be able to, be treated, because if this is left untreated, it might get worse and, it could develop some complications. So, by the way, may family history ka ba ng cholecystitis?
Yes, Doc. Si Mama po noon nag-undergo po siya ng open cholecystectomy. Possible po ba na hereditary ang sakit ni Mama?
So it's possible because genetic factors plays an important role in the developing of this cholecystitis disease. Usually about 50 to 70% of cholecystitis patients have a positive family history of this disease. In addition to that, yung epidemiologic studies have shown also that environmental factors and genetic elements are contributing into this gallstone formation. So usually, through a lot of studies, yung mga twins or families or ethnicities with gallstone formation, yun yung mga genetic elements. So also for your information, yung greatest risk of developing this factor is the calculus cholecystitis, which is the gallstones, and the risk factors for gallstones includes female sex, increasing age more than 60 years old, pregnancy, some oral contraceptives, obesity, and also diabetic patients. So yun yung mga pwede mag-cause nitong cholecystitis disease.
Sige po, Doc. Maraming salamat.
Alright, have a good day. Bye-bye. Hello, good morning. Ano pang maitutulong ko sa inyo?
Morning, Doc. Doc, kahapon na po online consultation na ako sa inyo. Kaya hindi na ako magdalawang isip na po.
Ikaw ba yung tumawag sa akin kahapon? So, you're Teddy, right?
Yes po, Doc.
Okay, this is what we're gonna do. We're just gonna assess you first, and have the nurse help me out, and she will assist you in some diagnostic tests that we're gonna run, and we'll confirm what you're having, if it's acute cholecystitis or whatnot. So we're just gonna verify if it's acute or chronic. Is that okay?
Doc, ano po yung mga test na gagawin natin?
So usually the diagnostic tests that we're going to be doing are some blood work. So we're just going to check any signs of inflammation in your body, and also an ultrasound of your abdomen to check for gallstones or other signs of a problem with your gallbladder. So sometimes we also do some x-rays or CT scan, magnetic resonance imaging, or the MRI scan. This can also be carried out to examiner, so that we could check on your gallbladder in more detailed form, and if there's any uncertainty about your diagnosis.
Okay po, Doc. Thank you po.
Okay. I'll just call the nurse, okay, so that we can assess you.
Good day po.
Good day po.
Kuhanin ko lang po ng vital signs. Okay lang po ba?
Okay po.
Okay po.
So, based on your results, our differential diagnosis is positive for cholecystitis, which is acute. Well, actually, it's a definitive diagnosis because we run all this test.
Totoo po, Dok. Ano po pwede natin gawin?
Yeah, so you'll probably be needing to be admitted to the hospital for treatment. So the initial treatment will usually involve fasting or not eating or drinking so that we could take a strain of your gallbladder. Then we'll be receiving fluids through a drip directly into a vein, which is the IV, to prevent dehydration. Taking medication to relieve your pain. And if you have any suspect infection, you will also be given some antibiotics. So this often need to be continued for usually up to a week, during which time you will need to stay in the hospital or you may be able to go home. But with this initial treatment, any gallstones that may have caused the condition usually fall back into the gallbladder and the inflammation often settles down. Good day, Teddy. It's Teddy, right?
Yes po.
So, in order to prevent acute cholecystitis, which is recurring, and reduce your risk of developing potential serious complication, we need to remove your gallbladder, which will often be recommended at some point after the initial treatment. This type of surgery is known as cholecystectomy. So, there are some surgeries that can be carried out in two main ways. One is the laparoscopic cholecystectomy, which is a type of keyhole surgery where the gallbladder is removed using special surgical instruments inserted through a number of small cuts or incisions in your abdomen. And then another one is the open cholecystectomy. This is where the gallbladder is removed through a single larger incision in your abdomen. Although some people who had their gallbladder removed have reported symptoms of bloating and diarrhea after eating certain foods, you can lead a perfectly normal life without a gallbladder. The organ can be useful, but it's not essential, as your liver will still produce some bile to digest food.
For post-op nursing intervention, change dressing as often as necessary. Clean the skin with soap and water. Use sterile petroleum jelly, gauze, zinc oxide, or caraya powder around the incision. And then apply Montgomery straps. And also we can use a disposable ostomy bag over a stab wound drain. And also place the patient in a low or semi-fowler position. And we can check the tube, the T-tube and incisional drains, and we will make sure that they are free-flowing. And maintain the T-tube in a closed collection system, and anchor the drainage tube, allowing sufficient tubing to permit free turning and avoid kinks and twins. And clamp the T-tube per schedule. And lastly, we can administer antibiotics as needed.
Teddy, ano to?
Ano yan, ma?
Ano yan?
Mga
Ano ba dapat kong malaman?
Mga resulta to galing Mount Carmel. Sandali lang.
Ano bang dapat kong malaman? Ano?
Ate Teddy, siguro sabihin mo na.
Alam mo kung anong nangyayari sa ate mo? Di ko man lang alam.
Hindi naman sa alam ko, ma, pero ilang araw na kasi nakikita ko yung si ate nagsusuka, tapos ayun, anong sintomas yung nakikita ko sa kanya gabi-gabi. Tapos alam mo, ma, yung isang araw nakita ko si ate pumunta sa hospital. Ewan kung na-admit or ano. Lalapitan ko sana si ate, kaso baka nahihiya siya, kaya di ko na siya nalapitan. Ayun.
Nakikita mo ako?
Oo, ate. Nakita ko na na-admit ka, nakita ko lahat. Hindi na ako lumapit sa'yo kasi alam ko nahiya ka sa amin. Alam
So-
ko, sasabihin niya sa'yo, ma. Alam ko, sasabihin niya sa'yo.
So ano ang totoo? Kasi sinungaling kayo sa akin.
Hindi, ate, sabihin mo na, ate.
Christian J!
Ate, ma, bakit ako?
Please naman, CJ, sabihin mo na.
Ate, sabihin mo na. Please.
Akala mo ba, CJ, madali to sa akin?
Kaya nga sabihin mo na eh, para hindi ka nahihirapan.
Oo na, aaminin ko na. Ma, I'm sorry, Ma.
Teddy,
Matagal ko na pong nararamdaman yung sakit na to, pero hindi ko po masabi sa inyo.
Teddy naman.
Nagpa-check up na po ako, tapos ginawa na po yung surgery. Ayoko na po kayo mag-alala dahil po alam ko busy po kayo sa kasal ni CJ. Ma, I'm sorry.
Teddy naman. Teddy, did you honestly think na hindi ko kayo maiintindihan? Kayo pang mga anak ko? Mula ngayon, anak kita. Dapat sasabihin mo sa akin yung lahat, Teddy. Anak kita, Teddy. Mahal na mahal ko kayong mga magkakapatid.
Opo, Ma.
Tuloy-tuloy na ang healing process ni Teddy kasama ang kanyang pamilya. At syempre, sa kasal ni CJ pa rin ang ending nito.